Hi, I'm Isabel Capella, and I'm going to talk about breast cancer and antioxidants. Cancer, as stated in her book in page 160, it's a genetic disease caused by multiple mutations in genes responsible for controlling cell division. Breast cancer is a cancer that starts in the cells of the breast in women and men. Worldwide, breast cancer is the second most common type of cancer after lung cancer. Causes of breast cancer. Breast cancer is caused by lesions to the DNA, such as genetic mutations. Mutations that can lead to breast cancer have been experimentally linked to estrogen exposures. Another cause will be failure of the immune surveillance. Immune surveillance is a theory in which the immune system removes malignant cells throughout our lives. Another cause will be abnormal growth factor signaling in the interaction between stromal cells and epithelial cells that facilitate the growth of malignant tumors or malignant cells that create tumors. Another cause is the inherited defects in DNA repair genes, such as BRCA1, BRCA2, and P53. BRCA1 and BRCA2 are the abnormal genes associated with most inherited cases of breast cancer. Some treatments and preventions for breast cancer. One, the first one and the most important one, it's avoid tobacco. Tobacco causes more than 30% of all cancers. Some treatments are the hormone treatments. Hormones can kill cancer cells, make cancer cells grow more slowly, or stop them from growing at all. Soy has something called phytoestrogens. Phytoestrogens are plant-derived xenoestrogens that function as estrogen in a female body. The intake of folic acid helps with the prevention of breast cancer. Then surgery to remove any tumors from the breast, chemotherapy, radiotherapy, and dietary intakes. With the dietary intakes comes antioxidants. Antioxidants are substances that inhibit oxidation or that remove potentially damaging oxidizing agents in a living organism. The industry uses antioxidants to counterattack the deterioration of stored food products. Some antioxidants are vitamin C, vitamin E, and enzymes such as catalase or dismutase. There are some studies that show that low levels of antioxidants or inhibition of the antioxidant enzymes cause oxidative stress and may damage or kill cells, creating cancer. Antioxidants and breast cancer. Okay, why are antioxidants good? Antioxidants maintain the cellular integrity and they boost the immune and the reproductive system. Antioxidants cause a regression of premalignant lesions or inhibit development of these lesions into cancer. Breast cancer occurs as a culmination of a multi-step process. Vitamins, through their effect in many cellular functions, again, they prevent oxidation, may potentially interfere with breast carcinogenesis. In an animal test, vitamin E has counteract cellular proliferation and protects against carcinogen-induced mammary tumor development. Vitamin E is the collective name of a set of A-related tocopherols, which are lipid-soluble vitamins with antioxidant properties. I'm going to get more into depth into vitamin E because I have found some research that tells you that the intake of vitamin E will prevent breast cancer or at least diminish the breast cancer risk. 1A tocopherol is the most important lipid-soluble antioxidant. The recommended dose is 50 milligrams daily for adults. It protects cell membranes from oxidation by reacting with lipid radicals produced in the lipid peroxidation chain reaction. This will remove the free radicals and prevent the oxidation reaction to continue. The radicals produced in this process may be recycled and used as a reduced form by other antioxidants like retinol or ubiquinol. As I said before, there's different studies that show that vitamin E have properties to prevent or stop the development of breast cancer. There's two studies in particular, the Shanghai Breast Cancer Study and the Women's Health Initiative Observational Study. I'm going to start with the last one, with the Women Health Initiative observational study, because it was a cohort made in the United States with postmenopausal women. The scientists were observing the estrogen receptor, progesterone receptors, and the correlation with carotenoids, vitamin C, and vitamin E. And at slide 11, you're going to see that the dietary intake was derived from a semi-quantitative food frequency questionnaire, which sees the frequencies and serving sizes of 122 food items consumed over the past 3 months. The intake was calculated by multiplying proportion sizes by the number of servings per day and its nutrient content. What I got for reading the article was that it was treated like a Weight Watchers. Like, points were assigned to different foods, and then all the points were calculated to get the actual intake of vitamin E. This study was done within a population of 84,805 patients, which they had 2,879 new cases with invasive breast cancer. Overall, invasive breast cancer were most likely to be non-Hispanic whites with higher education, late pregnancies, and family history of breast cancer. And they usually have consumed more tobacco and more alcohol. The study showed that vitamin E helps with the prevention or diminution of the development of breast cancer. There was no association with the high levels of vitamin E daily intake. However, there was a high association with low vitamin E daily intake, meaning that it doesn't matter how much you take. However, if you don't take enough, then there's going to be a higher risk for you to get breast cancer. These observations were mostly done in women that were physically active and they have a regular body mass index. The second study was the study I liked the most, was the Shanghai breast cancer study. There was a large population with a base control, and it had 2 phases. There was one phase between August of 96 to March of 98, and then April of 2002 and February of 2005. These participants were have no story of breast cancer. Again, there was a questionnaire filled like in the first study, and that covered 85% of Shanghai's most commonly consumed foods that were approved by the government. The 2 phases were easy in comparison because they just had few difference. Like, for instance, in the second phase, there were older women and they had higher education. They had a better background and better socioeconomic status. Tobacco and alcohol consumption was not taken into account in the Shanghai study. The result says that it's possible that vitamin E consumption may confer protection against breast cancer among women with low intake. Vitamin E intake is associated with the decrease of breast cancer risk. Vitamin supplements is associated with the income or the education level of the individual, and the vitamin E is only associated with the decrease. It is not proven to be directly responsible. This study was one of the best to prove the relationship between vitamin E and breast cancer. We have to take into account that Shanghai's food does not contain added nutrients or vitamins, and that this study was done with a small population, and it was not enough consistency because the 2 sessions were different one from each other. Remember that the second one had higher education and women were older. And lastly, to conclude, I want to say that vitamins alone are not sufficient for the prevention of breast cancer. You need to be away from tobacco, and you need to have a healthier lifestyle and a healthier environment around you, because as shown in the other studies, cancer studies depend on the population and on the culture of the person. Finally, I want to say that antioxidants, especially vitamin E, help in the prevention of breast cancer, or at least in the decrease of breast cancer risk.